So what's the most skincare mistakes that you have seen people doing it?
Sunscreen should be of PA 3 plus or 4 plus.
So what's the most skincare routine you recommend?
For instant glow, my favorite is
Facial literally helps in slow aging.
who used to be very angry all the time. So
Right.
if they use Botox since their early age, that lines will not appear.
So do you think that social media has worsened like how people see themselves?
So if you're 60 kg, you need 60 grams of protein per day for healthy skin and healthy hair.
Any recommendation that you would like to give regarding moisturizer? Welcome to Unscripted with Kena Shah, powered by Shankus Season 1. So from acne to anti-aging and from hair fall to glowing skin, today's guest has all the answers because she's not only a dermatologist but also an aesthetic physician that has transformed thousands of faces and stories. So today's episode, your skin is going to thank you for. Please welcome Dr. Khyati Vasavda to the show. Dr. Khyati, can you please tell us about you?
Yes, so hi, I'm Dr. Khyati Vasavda. I'm practicing at Ahmedabad since last 15 years as a clinical dermatologist. So we treat diseases of skin, hair and nail, and we do aesthetic treatments and lasers as well.
Right. So while I was growing up, I faced lots of skin related issues in terms of I had lots of acne, because of which I used to go to dermat a lot. And later I realized that, if you have a nice skin, then it literally boosts your self-esteem. So that is when the admire for dermatologist and that came into picture. So I really want to know, while you were growing up, did you face such challenges with your skin?
No, so I visited a dermatologist only once or twice in my teenage.
Oh,
frankly, I didn't have any acne issues when I was growing up.
Right. So what got you into this field?
So I was into art since childhood, and in this field, I can use that aesthetic sense or artistic nature because we can make people beautiful.
Right.
Or aesthetically beautiful, you can say that.
Right. So it was your passion that led you to,
yes,
to becoming a dermat.
Yeah.
So do you think that social media has worsened like how, people see themselves when it comes to their skin and themselves?
Yes. So when you are using social media, you don't realize, you think this person has a very glass skin and it's a very clear skin, glass skin or Korean skin, whatever you can say. They may have used filters or they may have applied makeup, anything. So you feel that their skin is very clear, and we also want that kind of skin, and that is kind of very unrealistic expectation. You have to work a lot to get that kind of clearer skin without any blemishes or without any acne.
Yeah. So do you think that gut health and mental health really affects your skin?
Yes, of course. Because when your mental health is not proper, you are in too much stress, it can worsen your acne or any pre-existing skin conditions like eczema, hair fall. Everything got worsened because of stress. So skin is the largest body organ. Right. You can say that whatever going inside your body will reflect outside on your skin and hair.
Definitely.
So when you have thyroid, you can easily say you can have dry skin, hair fall, hair thinning here. Any kind of internal hormonal problems can also reflect on your skin and on your hair.
Yeah. So what's the difference between dermatologist, cosmetologist and aesthetics?
So see, dermatologists are proper medical doctors. So we have done MBBS, then we have done internship, then we have done post-graduation in dermatology.
Right.
Aestheticians or cosmetologists are people who have done maybe few days or few weeks of course, and then they are practicing lasers and anti-aging treatments.
So what falls under dermatologist and what falls under
dermatology, actually we are treating skin diseases, hair diseases, nail problems and venereal diseases. So venereal diseases are sexually transmitted diseases which also comes under the dermatology. So the Association of Dermatologists is IADVL, Indian Association of Dermatologists, Venereology and Leprology. So dermatology is clinical skin problems, etc. The venereology is sexually transmitted diseases, and leprology is leprosy. Okay. Have you seen those people outside the temples who don't have their fingers and all? So leprosy is a bacterial disease and it's still not gone. from our environment. So we still see the patients of leprosy.
So what's the most skincare mistakes that you have seen people doing it nowadays, and then they have to come and visit you because of those problems?
Nowadays, people has so much exposure because of social media, Instagram. They see YouTube videos and reels, and they try many hacks at home. So sometimes they apply toothpaste or garlic on their moles, and then they burn it, and it becomes very bad. That even we struggle a lot to make it proper. So sometimes they say somebody have told them to use this.
Yeah.
Or they may just go to the medical shop and will take any random creams which is suggested by neighbors or relatives or friends.
Yeah.
So some creams for pigmentation, like I would not take the name, but it contains hydroquinone. So that's a molecule which should be used for a very shorter period of time. When we prescribe it, we write it that use only for 15 days or only for 20 days. They keep using it for months, and then it again causes another type of pigmentation which is very stubborn and very difficult to treat it.
Yeah.
So we generally want to say people that don't use anything by yourselves, by just seeing random videos or reels.
So what's the most skincare routine you recommend,
So most effective and most simple skincare routine is just use proper face wash for cleanser or a cleanser, and then apply a moisturizer and a sunscreen.
Okay.
That is the simplest which teenagers can also use. When you are in 20s, this is enough. When you are above 25 or 26 years old, you can use retinols. And youngsters can use hyaluronic acid because it's just a kind of moisturizer which naturally also present in our skin.
So it is not that when you use certain acids like this, that it can damage the skin if you use it for the longer time.
So see, the acids is just the chemical names. They are not actually like acids.
Right.
It's not very strong. It's very helpful. It exfoliates mildly your skin and then gives glow and etc. So in older times, our queens used to take bath with chash, the buttermilk, because it has lactic acid. So we have lactic acid peels which are nicely gel based. Just apply for few minutes and remove it, and then it gives a nice glow.
Oh, is it?
Yeah.
So what about anti-aging? So what is the ideal age to start with anti-aging process, or maybe the skincare?
Yes, for skincare, you have to start it after you are 25 or 26.
So that early?
Yeah.
Okay.
Because once till 30, you will see your face will look the same. After you are 30 crossed, and you'll see your photo at 35, you'll feel a lot of difference.
Yeah.
You will feel like I'm looking more aged, or age दिखने लगी है. That is the reason is collagen formation will reduce after 30 year of age, and it will reduce every year. So you have to use some creams which gives collagen production, like your retinol creams will induce collagen production, and then in clinic procedures which can help you for your collagen building underneath your skin.
Achha, so in case if we, so you are recommending that post 25, 26, you should start with the anti-aging products, right? So when we start with those kind of products, right, we should be focused only with the skincare products, or is it like we should go with some treatment also regarding anti-aging?
So see, in your 20s or till 30, it's okay if you just use your skincare routine at your home. But if you feel that with this you can treat your acne or pigmentation, if you have more concerns which you're not able to treat with the home care routine, you can go to a qualified dermatologist and go for lasers or peeling, which is very effective to treat pigmentation and your spots, acne, etc.
Acha. So does facial, literally helps in slow aging, or is just a myth?
It's not a myth. It helps a little bit because see, facials are very superficial. They will act to the certain extent. For actual anti-aging, my favorite thing is microneedling because it forms nice collagen underneath your skin, and if you don't have any scarring, you can do it every 3-4 months, and it tightens your pores, it prevents your fine line formation, etc.
Okay.
So that is a very good option to, and it's very affordable also. It's very easy. It has less downtime. So see, downtime is after doing any treatment or laser, for how many hours or how many days your skin stays red or dark. That is called your downtime. So nowadays people want treatment which has less downtime.
Right. Yeah. And also, you mentioned that one of the effective, would be to include SPF, right?
Yes.
Right. So, can you share more details about SPF? So, what is SPF first of all?
So see, whenever you are out or you are in,
Yeah.
you have to apply sunscreen because you have
even though
glass.
you are indoors.
Yeah, even though you are indoors, because you have glass windows in your office or your houses, you are constantly using screens which emits blue light.
Yeah.
So we keep using our mobile phones. Sunlight, whether it's there or not, UV light is always there. So UV rays, ultraviolet rays are of certain types, like UVA and UVB are most concerned.
Yeah.
So that causes tanning and aging.
Okay.
So to prevent that, you have to use sunscreen. SPF is sun protection factor, which shows effectiveness of your sunscreen, that how long it will protect you from UVB rays. For UVA rays, you have to see PA rating.
PA rating.
So yeah, PA rating is, so your sunscreen should be of PA plus 3 plus or 4 plus, then that will protect you from UVA rays also.
So, what is it recommended? Go for SPF 50 or SPF 30?
So see, SPF 30 will protect you 97% and SPF 50 will give you 99% protection. So there is a difference of only 1 or 2%, but routinely 40 to 50 is advisable if you are going too much outdoors, or if you're doing swimming, or if you are doing sports constantly for few hours in the sun, and you have to reapply it also.
Yeah, that's what I was also thinking, that when it comes to SPF, what is important, that is it SPF 50 or 30, or that how many times you are reapplying the moisturizer.
Yes, so both is important.
Both are
SPF
important.
is also important, and it's not like that you have applied 50. Nowadays 80 SPF sunscreens are also available.
Oh,
that doesn't mean you apply once in a morning and then you don't apply.
But do you apply SPF 80 here in Ahmedabad?
People
this
do
weather in
apply.
mind?
People do apply when they are going on a beach holidays.
Beach?
And mainly for bodies.
For bodies,
Because
okay.
as SPF increases, that will make the sunscreen little more oily.
Yeah.
So for face, it's very
Sweating,
difficult
yeah.
to apply 70, 80 SPF sunscreen.
So ideal is 30 and 50.
Ideal is 30 and 50, yeah.
Okay. So when we are talking about SPF, right? So I have this tendency of not applying SPF. I'm somebody who only, use moisturizer, because I have a tendency of oily and dry skin, right? So what do you recommend? Like, should I be skipping my moisturizer and then apply and go for SPF, or how should I be doing?
So ideally both.
Yeah.
First layer we'll apply moisturizer, and then sunscreen should be on the topmost layer. But there are nice sunscreens now which are very hydrating and they have moisturizer inside there. So you can use that kind of sunscreen also. And if you have acne prone skin, there are some different moisturizers which are not very greasy, or you should read a word non-comedogenic on your products. That means that product has less tendency to give you pimples.
Oh,
so you can use those kind of moisturizer and then apply sunscreen. And there are people who don't want to apply so many products. They are very busy, particularly the male patients. So we give them very easy skincare routine which they can follow.
Yeah, which they can follow. So
Yes.
are there any recommendation that you would like to give regarding moisturizer?
Yes, so for very acne prone skin, there are moisturizers like Acne Moist Cream or Acrophy Acne Moisturizer or Aha Glow Acne Moisturizer.
Yeah, I personally use Aha Glow, so I know the effect is very good. It makes your skin feel fresh and energetic.
Exactly.
So what are your thoughts when it comes to expensive products? Are they always very effective?
So see, there are few kinds of products which are very expensive.
Right.
They are also super effective, but it's not like reasonable products are less effective.
Okay.
So we give according to patient's choices.
Right. When it comes to Botox and fillers, if we talk about cosmetologists and aesthetics purpose, right? So what does Botox and fillers do?
So see, people has a myth that Botox and filler, they call it plastic surgery. First of all,
Isn't it plastic?
It's not. They're just injections.
Okay.
There is nothing, no kind of surgery in Botox and filler. So Botox is a trade name. Basically, it's a botulinum toxin, which is a protein and which relaxes your expression lines and muscles.
Okay.
So you inject your muscle, which is giving you the line, and you are doing it regularly. So the line will not become permanent.
Right.
So that is a true anti-aging. If you start it early in your late 20s or 30s, your lines will not become permanent. You have seen people who used to be very angry all the time, like they are always doing this, and they will get permanent 2 lines, like 11. It is called 11 lines in their mid eyebrow region. So
Right.
if they use Botox since their early age, that lines will not appear in future.
So
It's
they
very
don't
safe.
have
It's
they don't
safe.
have any side effects.
Not really. See, Botox is being used in children also in certain medical conditions. It's not for old people. Generally, people has myth that Botox and filler is not for young people. And filler is a all the way different thing. It's a hyaluronic acid which we inject, which we also have natural hyaluronic acid in our skin.
Yeah.
And it is the same thing in syringe. So we fill the hollows with the filler. If you have deep sunken under eye area, we can put filler and make it smooth. If you have very smaller lips, you can make it normal size or little bigger if that's also a patient's choice.
Right.
And you can design your lips or chins with the filler.
Okay. And what do you recommend when it comes to, removing of makeup while not damaging your skin? Because I'm sure there would be we women love doing makeup, right? So
Yes.
are there any technique or, products that we should be using that doesn't damage our skin?
Yes. So whenever you have applied the makeup, first thing you will go home and remove it.
Yeah.
However you are tired, you should never sleep with your makeup on. So double cleansing method is better.
Okay.
First you remove it with the cleanser or your makeup remover, there are many nice makeup remover available in the market. One is Bioderma Sensi Bio. It's very good makeup remover. You remove your makeup. You have specific makeup remover for your eye makeup. Then you wash your face properly with the face wash and then apply moisturizer.
Okay.
And don't rub too much.
So and what, because you really have a good skin, and because you mentioned that you are already 40 but you look very young, right? So do you follow any skincare routine or something like tips that you would want to share with us?
Yes, so generally I don't apply makeup. First
Okay.
of all,
But you don't need makeup.
yeah, so when you have clear skin, generally you don't need makeup. It's a vicious cycle.
Yeah.
So people have spots and acne. To hide them, they will apply makeup. Then the makeup will clog their pores and then they'll have more breakouts.
Yeah.
So it keeps happening.
Yeah.
Sometimes you have to break that cycle. See, when the makeup is necessary, it's necessary.
Yeah.
But the teenagers should not become very conscious.
Yeah.
Sometimes they apply pimple patches. There are
Isn't
too
it
many.
useful?
It is useful if you have one or
And
two
is it
pimples.
effective? Yeah, one or two.
Yeah,
yes.
it is effective.
It is effective,
You have to
okay.
apply it for few hours, and then that will reduce your acne size.
Right.
And it comes, they are transparent patches, so you can apply your makeup on it.
Yeah. So what are the tips that you would want to share?
So the main tip I want to share is, for healthy skin, you have to need good sleep,
Yeah.
good lifestyle routine. Junk food and milk products can increase your acne. So we have seen in COVID times, everybody had clear skin because they were eating
Halka
healthy, they were
khana.
sleeping properly. And nowadays, and you don't need to do 10-layer skincare routine.
Yeah.
Like, you cannot have Korean skin with that. For
Yeah.
Korean skin, you need Korean genes.
Yeah, that's the biggest myth. I feel people feel that
Yes,
just by
yes.
using the product, we might start having such kind of smooth skin.
Yes.
But yeah, that's very
So
challenging.
proper 8 hours sleep, proper diet, exercise, everything is important when it comes to the
So when
results.
can sugar lead to, more swallowness is what I've heard. I don't know if
That
that's
is
correct.
salt, not sugar.
That's just salt. Okay.
So
Okay,
sugar
salt.
will
excess salt,
yeah,
right?
Yeah, excessive salt in the dinner time or after evening
Yeah.
can make your eyes look more puffy. So the under eye bags you see in few people, when they get up, they have little baggy eyes,
Yeah.
and then the day pass on, it will start reducing.
Acha.
So that is because of high salt intake, and for that we don't use fillers.
Yeah, for
That is a fat protrusion. So for those conditions, if we do filler, it will look even more worse.
Yeah.
So you have to go to a plastic surgeon for that, like oculoplasty surgeons. They are eye surgeons and doing plastic surgeries for that.
Yeah. So what kind of food, one should consume in order to keep their gut healthy? So at the end, it will reflect their skin.
Yeah, so for food, you need to take protein as per your daily requirements. So if you're 60 kg, you need 60 grams of protein per day for healthy skin and healthy hair, which is difficult to get from your vegetarian diet.
Yeah.
So you can eat a lot of sprouts. Instead of paneer, you can have tofu.
Tofu, yeah.
So sprouts, tofu, then you have green vegetables, different color vegetables and fruits, like some yellow fruits have carotenoids in that. So you eat mangoes or papaya, capsicum. So you should have different colored food in your plate.
Yeah.
That is good for your skin.
So basically people say, कि जो खाओ वो मुंह पे लगा सको तो ही खाओ.
No, that's not true. You have to eat it.
Yeah, you have
not
to eat.
lagana.
Not lagana. I also wanted to know that when you apply oil in your scalp, right? So is it actually doing any repair or it's of no use, so you can avoid applying oil?
Yes, so see, oil is very favorite things for all moms and grandmothers.
I know.
So it will protect your hair shaft from external environment like dust and etc. But that will not promote your hair growth.
Okay.
Actually, the teenagers or people who are having acne, they should avoid application of oil because it all comes on your face and then it will
leads to acne.
Yeah, it will lead to more acne and the people with dandruff. So people think they have dry scalp, they should apply oil. But actually then eventually it will increase the growth of the fungus which is causing dandruff. So the dandruff problem will worsen more.
Yeah.
So the people with dandruff and acne should avoid oil application. Ideally, if you want to use, just use on your hair shaft, keep it for 1 hour and then wash it.
Okay. And when we were talking about green foods, right?
Yes.
Do you recommend having juices like any kind of green juice?
See, green juices are okay.
Green juices are okay.
But
Not the
fruit,
orange
no,
juice
the fruit juices have high glycemic index. If you'll eat orange, you will eat 1 or 2 oranges.
Yeah.
If you will drink orange juice, you will drink juice of like 4, 5, 6
and that
oranges.
has added sugar.
Yeah, that has a more glycemic index.
Okay.
And that can cause acne. There are patients, we just tell them to avoid the juices and milk and their acne will reduce dramatically.
And you should also be avoiding dairy products, or?
Yeah, dairy products also to the certain extent. So curd and buttermilk is okay, but you should try avoiding milk, cheese, etc.
Okay.
In few people, it can cause more acne. If you don't have any problem with that, you can continue it.
Okay. And also, is there any certain duration when you should be visiting your dermat? Of course, if you have a problem, you should visit. But I always had this notion, and that's why, I used to keep going to my dermat because I have always been very conscious about my skin, right? Because my skin is very sensitive, so I cannot apply anything and everything. So is there any duration के 2 महीनों में एक बार दिखाना है या 6 महीनों में एक बार दिखाना है?
Yeah, so that depends on what condition you have.
Okay.
So your dermat only will suggest you that you have to come every 15 days or every 1 month.
Nice.
There are some conditions that certain medicines are given. We have to do reports regularly.
Yeah.
That is a different thing. But once in a 1 or 1.5 month, just for routine treatment,
Checkup,
like normal facials, or my favorite is Q-switch laser or micro needling. Micro needling you can also do every 3 to 4 months. Okay. If you have scars, we do it every 1.5 months. Like 6 to 8 weeks it takes to make your collagen.
Okay.
So we do 1 micro needling, then we call you after 1.5 months.
And if you don't have scars,
if you don't have, then once in a 3, 4, 5 months is fine.
Okay. So
like my kind of skin.
Is this for instant glow? That is what you are recommending?
No, instant glow. For instant glow, my favorite is Q-switch laser toning.
Okay.
And chemical peels.
Okay, I
gives
know
you nice glow.
about chemical peeling. What is the Q-switch laser that you are talking about?
So Q-switch laser is a laser which will reduce your pigmentation, and that will also that will also form little collagen, and your skin tone can become little lighter with that laser.
It works on all the
Yeah,
body
but that
parts?
doesn't mean you do every weekly.
Yeah. It applies.
So,
It can be done on all the body
You
parts.
have to have gap of at least 20, minimum 20 days between two treatments, because you have to give time to your skin to heal in
Yeah.
between the treatments.
And nowadays, I am sure a lot of females will be coming with, hair loss problems.
Yes, so now we see a lot of patients with PCOS and subclinical PCOS.
Yeah.
So they have widening of their partitions
Partition.
and hair loss in this area.
Yeah.
So most of the people have hormonal problems or the nutritional deficiencies. It's very, very common in India.
Yeah.
So if there is something wrong inside, it will not help whatever you do from outside.
Yeah.
Like people come us and tell us हमें PRP करना है.
Yeah. Yes, yes.
So,
yes.
but your hemoglobin is low, your B12, D3, your vitamins are low. Whatever PRP you will do, it will not help you.
Right. So
So
in that
you have to
case,
check
what do
it,
you
yeah,
do?
yeah.
In that case, what do you do? So if the all the after the reports, it's not sufficient for PRP.
Then we have to give them supplements.
So you have to give them
Yeah.
supplements.
Then the hair fall becomes normal.
But
There is a skin condition called telogen effluvium. So
Okay.
if you have any kind of major physical or mental stress, like COVID, you must have heard after COVID many people had hair fall.
yeah.
So after the disease, उसके 2.5 or 3 months के बाद, you will have a lot of hair fall.
Yeah, stress of course leads to hair fall.
Exactly.
Yes.
So in routine, if your hair fall count is 100 per day, it's normal.
Okay.
But in
100%.
telogen effluvium, you may have 2 to 300 hairs falling every day. It happens for few months and then it becomes normal. But to prevent it from becoming permanent, you have to go to a dermatologist and treat that condition.
Okay. And what other options except PRP do we have when it comes to the thinning parts?
So the thinning part is mainly hormonal, and you have to use, there is a medicine called minoxidil. So you have to apply it ideally lifelong till you want your hair.
Yeah.
Once you stop applying it, the effect goes. But that doesn't mean it will worsen.
Yeah.
But that is the most effective treatment.
Is PRP
Yeah.
effective?
Yes, PRP is effective and it's being done from your own blood, so it's safe. But
Yeah.
ideally, it should be done under aseptic precautions and ideally done by professional doctors or nurses.
Yeah, that is
not
must.
by anybody.
Yeah. Yes.
Because whenever you are dealing with blood products, you have to be careful.
Okay.
But it's quite effective and easy.
Yeah.
So
PRP is
we take patient's blood, we centrifuge it, and the serum separates, which has growth factors and platelets,
Yeah.
which we inject in hair, and it reduces your hair fall, it makes your hair thicker, and then you maintain with medicines. And if
Right.
the same thing we inject on the face, that is called vampire facial.
vampire facial. Yeah. So vampire facial is also about for the glow, right?
Yeah, it's kind of preventive thing.
As a
The
preventive.
results are variable. It's not जादू हो जाएगा.
So you have to be very consistent with
Exactly.
the vampire facials, no? Okay, that's very interesting, and thank you so much. Really had a great time. It was very insightful. Thank you for coming to the show.
Thank you for inviting me.